Hi treasures, welcome back to the channel. Today we'll be answering a question, and this question reads, I am not pregnant. I do not have a baby. However, breast milk comes out from my nipples. What is the cause? So today we're going to be talking about the condition known as prolactinemia or hyperprolactinemia. And what is it? What it is, its risk factors, the causes, and whether we have natural remedies, and also what I will be telling you to do as a professional. So let's get right into today's video. Prolactinemia or hyperprolactinemia is a medical condition characterized by abnormally high levels of prolactin hormone in the body. Now, what is the prolactin hormone? This is a hormone that is primarily responsible for lactation, or what we call milk production in females. But it also has other functions in both males and females. Now, what are the risk factors for prolactinemia? The first one is prolactinoma. This is a benign tumor of the pituitary gland which can lead to increased production of the prolactin. So the pituitary gland is the gland responsible for the production of this hormone. So when there is an increase in growth of that gland, that is what we call a tumor, increase in size of that particular gland, it can result to overproduction of prolactin or increased production of prolactin, causing high levels to be found in the blood. The second cause can be medications. Medications such as antipsychotics, antidepressant, high-dose estrogen can cause elevated prolactin levels. The third is hypothyroidism. An underactive thyroid gland can result in increased prolactin secretion. The fourth is chronic kidney disease. Impaired kidney function can disrupt normal clearance of prolactin from the body. Remember, the kidney is a major organ of excretion. So when there is an impairment of this organ, that it can lead to disruption in the normal clearance of prolactin, causing its high levels in the blood. Another cause can be chest wall injury or irritation, and damage to the chest wall can lead to elevated prolactin levels. Now, what are the signs and symptoms of prolactinemia? Remember, the signs and symptoms will depend on the underlying cause or what is causing it. It's also individualistic too. It depends on the individual. But however, the common signs and symptoms include irregular menstrual periods or absence of menstruation, what we call amenorrhea in women. Galactorrhea is another symptom. That is abnormal milk production or leakage from the breast unrelated to breastfeeding or pregnancy. So the woman is not pregnant, she's not breastfeeding, but there is leakage of milk from the breast. This is one of the major signs and symptoms, and that is what the person that asked today's question is actually experiencing. Another sign and symptom is infertility or difficulty in getting pregnant. Erectile dysfunction and decreased libido in men also can be seen. There is reduced bone density and increased risk of osteoporosis. Then headaches or visual disturbances can, if it is caused by pituitary tumor, can also be experienced. It's very, very important to know that high levels of prolactin does not necessarily mean that the person will experience these symptoms. But in some individuals, actually who have high levels of prolactin might even be asymptomatic. That's what I'm trying to explain. Now, what are the natural remedies for prolactinemia? Before I continue, please, if you have not subscribed to this channel, do well to subscribe. And if you have any questions so far from this video, do well to drop them in the comment section. Now let's continue. So what are the natural remedies for prolactinemia? It's important to note that despite there are some natural remedies to this condition, it's important that you meet your healthcare provider for adequate history taking and also diagnosis, so that the specific treatment can be initiated immediately. But like you all know, on this channel, we can never go wrong with natural remedies or lifestyle changes. So the first I have here is stress reduction. Chronic stress can disrupt hormonal balance. So engaging in relaxation techniques such as meditation, deep breathing exercises may be beneficial. Another lifestyle change is regular exercise. Physical activity can help regulate hormone levels and promote overall well-being. Then maintain a healthy weight. Being overweight or obese can contribute to hormonal imbalances. So maintaining a healthy weight through a balanced diet and regular exercise is very important. Now, avoidance of certain medications. If medication-induced prolactinemia is suspected, consult with your healthcare professional or whoever that prescribed the drugs to explore alternative medications or adjust your doses where necessary. So it's important that you meet your healthcare provider because maybe the drug might be very, very important. So those adjustment is very, very vital at this stage. Now, what are the preventions of prolactinemia? Regular medical checkups. Routine health screening can help detect and address any underlying condition contributing to prolactinemia. Medication management, we've said it, is important to know whether your medications are the cause of the rise in this hormone, and it's important to follow prescribed dosage and discuss any concerns you have with your healthcare provider. Another thing we can do is prompt management of chest wall injuries. Injuries to the chest wall already we've established is one of the risk factors to prolactinemia. So injuries to chest wall should be evaluated and treated properly to minimize the risks of prolactinemia. So for our diet, it should contain whole grains, green vegetables, broccoli, cabbage, cauliflower. We should also eat fatty fish like salmon, sardines, fish that are rich in omega-3 fatty acids. So legumes too, like lentils, beans, are good source of protein and helps in hormonal balance. Also, avocado is very, very good. Nuts and seeds like walnuts, chia seeds, flax seeds are excellent sources. Contain nutrients that support hormone synthesis. Also, herbal teas containing peppermint are very, very good. Then probiotic food like yogurt and fermented vegetables can promote gut health and indirectly they influence our hormonal health. So hope you enjoyed today's video. Do well to like, share and subscribe to this channel. If you have any question, you can drop it right here in the comment section, or you check our description for the email or our Instagram handle. Thanks. Till I come your way next time. I am Dr. Besa.